but you know what you're doing though, okay? You'll know how to do it. So first thing you do, you come in the room. I'm gonna come in the room. You can start recording. Okay. Hi.
Hi.
Sharon, how are you? My name is Sharon.
Hi Sharon, how are you?
I'm just picturing you. This is lovely. I'm here. I'm going to do a head. I'm from Vernon College. I'm going to do a head-to-toe assessment on you. Okay. So I want to ask permission.
Yes, you can do it.
Okay. This health assessment, what it's going to entail is you changing positions, sitting up, lying down, rolling over, whatever, whatnot. Do you have any problems with that?
No problem.
Okay. So I'm going to go over here and I'm going to wash my hands. Oh, y'all gonna just I'm gonna wash my hands, okay? I'm gonna provide privacy, okay? I have everything that I need right here. I'm gonna pull the curtain. So the first thing I'm gonna ask.
Really not gonna pull it so
Oh, that's right. Okay. So, can you tell me why you're here today?
I'm here for a health assessment.
Okay. Can you tell me, give me your name?
Shelley Pendleton,
Okay, and tell me where you are.
Vernon College.
Okay. You know what day of the week it is?
It is Tuesday.
Just for the fast. Okay, so Shelley, she's alert and oriented. ×4, she knows where she is. Her dress is appropriate. First thing I'm gonna do, facial expression is good. So I'm gonna go ahead and, my hands are cold, I apologize.
Please, no, that's fine, keep it cool.
So first thing I'm gonna do, I'm gonna check your skin. So I'm checking her pulse as I do this, and I'm looking at her nails. They're nice and pink. So I check that, and while I'm checking, she has good pulses there. I'm gonna check the turgor. I'm gonna check the skin integrity. I don't see any lesions or anything. Her temperature is warm to dry, warm to touch. I want you to squeeze my hands. Good. Okay. Next, I'm gonna check your head. Okay. So her head is normal cephalic. I don't feel any lesions. Nice and soft, okay? So, and next when I'm there, I'm gonna have you check cranial nerve number 7. So what I'm gonna ask you to do is to close your eyes, and you tell me if this is sharp or dull.
Do it again. Sharp. Dull. Dull. Sharp. Sharp. Dull.
So let's check cranial nerve number 7. Next thing I'm gonna do, I'm gonna have you.
Don't worry about that.
So
I want the cold. Go ahead.
My hands are cold. They're cold on.
I love it.
Okay, so I'm gonna have you to clench your teeth. Okay, I'm checking the cranial nerve as well. I should have brought my paper. Okay. And, now I'm gonna ask you to puff out your cheeks. Raise your eyebrows. Okay, let your cheeks out. Smile. Anyway, so like I said, we're checking the palpebral fissure. Next thing I'm gonna do, I said I did that. I'm gonna check your eyes. So doing that, I'm looking at your eyes, make sure they're symmetric. Your eyebrows are symmetric. I'm gonna palpate your lacrimal apparatus right here. I'm gonna check the conjunctiva and the bulbar. So if you'll look up for me, very good. All right. And feel free, if I miss something, you tell me and I'll go back and do it correctly. So I want you to just look straight ahead. I'm gonna check your pupils. Good, and they constrict. And next thing I'm gonna do, I'm gonna shine this in here, and I'm gonna look at the other eye to constrict, and it does. Okay. Next thing I'm gonna do, I want you to follow my pen light. And it come out, very good. Now I'm gonna check the 6th field of gaze. This is cranial nerves 3, 4, and 6. And before we get there, I checked her cranial nerve number 2 for visual acuity with the Snelling chart before we come in. So if you just follow my pen light. I'm almost feel I'm gonna put on the spot all these recorders.
No.
It's all right, I can do it. It'll be all
All we need to do is just do the flashcards.
Okay,
Flashcards,
next
at least you wanna-
we're gonna check accommodation. So I want you to focus on that light over there, then back at my pen. So focus at the light,
Okay.
and then back at the pen. As you focus there, your eyes dilate, and when they come back to the pen, they constrict. Okay, 3, 4, and 6. 1, 2. Okay. Accommodation.
Do you need a paper?
Huh?
Do you need a paper?
Oh yeah, give me a paper. Y'all wanna hold it in.
be going,
Mhm.
ah,
Mhm.
tongue.
I did that.
You didn't do tongue?
I ain't did a tongue yet. Just said, I did consensual, bubble. I did everything. Now listen to the ears. Praise the Lord. That was pretty good. Okay, so next, we're gonna check your hearing. This is cranial nerve number 8. I'm gonna have you to turn to that side. No, you know your whole body.
No,
to
the
that
whole
side.
body. We just have.
We used to did that on the table out there.
Yeah.
So I'm gonna whisper a couple of words to you, and you repeat after me.
Basketball,
And I meant to have you to cover up this ear, the right ear.
football,
Okay, now cover up the other ear.
banana.
You got good hearing. Next, okay, I'm gonna.
teacher hearing.
Kidding. Okay, now you just turn and just face this way. Next, I'm gonna use the tuning fork. I'm gonna do the Weber test, and tell me if you hear it in one side or just both sides.
You might wanna do that, because you'll hit that noise all yours out.
Okay.
Both sides.
Okay. And next, I'm gonna do the Rhine test. I'm gonna place it right here on your mastoid process. And tell me when you can no longer hear it.
It takes a while. Okay.
And tell me when you can no longer hear it.
Okay.
Okay, this testing air conduction versus bone conduction. Air conduction will be twice as long. Next, I'm gonna check your nose. This is cranial nerve number 1. So I'm gonna have you to close your eyes and tell me.
I'm getting better stuff at this day.
Okay. Oh, this is good. I can spin it.
Put it back out of there. Coconut?
Yeah. Okay. Cranial nerve number 1. So, checking the nose. I'm making sure the nose is symmetric. I'm gonna take my pen light. I'm gonna look inside your nose to see if I see anything. And there's no drainage. There's no polyp. Checking your turbinates. They're all good. That. Okay. Next, so I think I got all of that. The nose. Now I'm gonna check your ears that I forgot. Oh gosh, she's good. So, the ears. First thing I'm gonna do, I'm backing up. The external ear, gonna make sure you palpate it. I'm gonna look and make sure there's no drainage or anything, no cerumum or anything like that. Not the ears. Both ears are symmetrical. So we good there, the nose, did the eyes. I did that, and I'll palpate the tragus.
Thank you.
You can say it.
Oh, excuse me. Okay, next, I'm gonna look at the mouth. So, the mouth, I'm gonna look at the lips, make sure there's no cracks, anything like that.
Let me get some lipstick real quick.
Okay. Next, I'm gonna tell you to smile. Look, okay, you got all the teeth. I'm looking, can you open your mouth? And I'm gonna look in the mouth, I'm looking at the hard palate and the soft palate. Say ah. She had tonsils, okay? Say ah again, I can't see your uvula. The uvula go. Okay, there it goes. Okay, next, take my tongue blade. Now the tongue blades that you use, they should all be in a package. If not, they will be clean, because some of them, they hadn't been used, but I don't know if I got all of them. I got a package for each one. So I'm gonna have you open your mouth and say there. Then I want you to push up against the tongue, push up against my tongue blade on this side. Take your tongue out for me. You're checking the moisture of the tongue. Make sure it protrudes midline. See all the teeth. Did I get everything? Let me look, make sure I got it.
I think you did on that.
Oh, but I didn't tell you which nerves. Okay, okay. You said that's cranial nerve number 10. Then number 12 is when you push up against the tongue blade, you're testing the tongue strength and the protrusion. Okay, I think I got it all. Okay, if I didn't know it, tonsils, I said everything. Okay, and then when you use the tongue blade, please throw it in paint. I have a paper towel. Okay, and I forgot about came the camera, so I can't see. Okay, next thing I'm gonna do, I'm gonna check your neck. Okay, so first thing when I'm inspect your neck and make sure it's no swelling, no mass or anything like that. I'm gonna do your lymph nodes. So first, I'm gonna do the preauricular, postauricular, the submental, occipital, submental, submandibular, the tonsillar. Can you shrug your shoulders for me? Right here, the supraclavicular. I'm gonna check the cervical chain, the anterior, which is the deep cervical chain, and the posterior. Long as you have the right area where you're looking at, is what I'm looking for. Next, I'm gonna check your carotid. So palpate on either side. I'm gonna have you to swallow. Check the trachea. Swallow for me. Okay. I'm gonna have you to turn around. I'm gonna check your thyroid. And I'm gonna do the posterior approach. I'm gonna come and put my hands here and have you to tilt your head down and to the right. Okay, very good. Some palpating. There's some, we're not gonna move anything. Okay, so that's checking the thyroid. Next, I'm gonna have you to turn back around so we can see. And I'm gonna listen. The thyroid here. All right, and next I'm gonna check the carotid. Sorry, cold.
Yeah, it actually feels good. It's like the teeth there.
On one side. Okay, I think I did all that. Next, I'm gonna have you to lie down. I'm gonna check. Okay. So, and I need to make sure the bed is at a 45-degree angle. I'm gonna have you to turn your head to the side. I'm gonna check for JVD. Check and see if I see any visible pulsations. Okay. And I don't, so you're checking right here, you don't see anything there. Always make sure the bed is at a 30 to 45-degree angle. Okay, let's see, do I do everything? Y'all are so quiet, so attentive, nobody has anything. Good, that's good. Covered everything. All right, next I'm gonna check your arms and hands. Like I said, we already checked that. Capillary refill. Fingers. Now let's check your reflexes. Then I'll get to the anterior chest. Okay, so I'm gonna check your triceps here. So above the oblique.
I have reflexes.
Yes, you do. Okay,
I have
then
some hyper ones.
brachioradialis here.
Yeah.
That's fine. If you'll go ahead and turn around, I'm gonna check your knees as well.
Here, I'll just do it. Here.
Okay. Y'all can see. So you check the patella. You see over here, you go one time here. Yes, you do. Then you're gonna check the Achilles tendon. You're gonna tap here. All right. Now, next I'm gonna look at your breathing. I'm gonna check your back. So I'm gonna step back here. But look at your breathing.
Wait, you take hold. You know, but it is.
Sorry. So next I'm check for fremitus. So I'm gonna have you say 99.
99. 99. 99. 99.
Okay, good. Next I'm gonna listen. So, you take a deep breath every time my stethoscope moves. Deep breath for me. Let it out. Again. 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 You do it all the way. If you raise your arm up, I'm gonna check lateral. One more time. Okay. So you're gonna do that until we say, if I say okay, you're doing it the correct way, I'll say okay. But make sure you go lateral. Next, I'm gonna percuss. Okay. Now, you're gonna go all the way down, okay? So listen. Next, I'm gonna come anterior. Before I did, let me check for symmetric expansion. Turn it around. Sorry. I'm sorry. So,
Once she gets there, I'm okay. Let's just get
Okay.
there.
Take a deep breath. Let it out. So my hands are bilateral. Okay, let me go ahead and do it one more time so you get the tickling on now.
Yeah, I know.
Okay, you
Okay.
Okay.
Let me do it. Okay, ready?
Go. Okay, is that good? Okay. And the first thing you want to do, you want to make sure anterior, look at the breathing, the work of breathing. Make sure the respirations are even and unlabored. You do not percuss. You can check for fremitus, 99.
99.
And women, as far as you go, you can go under here if you want to, say 99.
99.
Okay? So then we're going to listen. Same thing. Take a deep breath and out. Good. Now, while we're here, we're going to go ahead and check your heart sounds while we're here. So, first, you're going to check aortic, pulmonic, Erb's point, tricuspid, the mitral. Okay, I will check this with the bell and the diaphragm of my stethoscope. With the apical of the mitral, you're going to palpate for 1 full minute as well as listen for 1 full minute. Okay, next we're going to go ahead and lie down. Let's check your abdomen. I'm going to let the bed all the way down flat.
9.
Oh, shoot. Oh, damn, I want it to come up. I don't want to lean.
That's right. Save your back.
Yeah, okay?
So much better than the table.
Yeah, she did it on the table the last time.
I'll even show a little bit of my belly.
You don't show it, I ain't sure.
Because my umbilicus is not midline. Just so you know.
So first thing you're gonna do, you're gonna look at the contour of the abdomen. You're gonna look at the umbilicus. You wanna see if you see any pulsations around about the aorta. And I do not. Check for symmetry. There's no lesions on the, well, yeah, there's a lesion, got a surgery or something like that. Next thing I'm gonna do, inspect. Then I'm gonna auscultate, and I'm gonna start auscultating at the right lower quadrant. So I'm gonna go right lower quadrant, right upper, left lower. Then after that, I'm gonna percuss. Oh, excuse me. Over here, when you percuss the liver, it should be dullness. Okay, over there, you will tell me that. So after you percuss, and then you're gonna palpate, starting at the right lower quadrant, this way, this way. Now, if you had a person that's very obese, then that's when you would do a little deep. You can use both hands. Okay. All right. Okay. Next, I'm gonna do, and I'm kind of out of sequence because I didn't check my vascular sound. So my vascular sounds, I'm gonna use the bell of my stethoscope. I'm gonna go just left to the midline for the aorta, the renal artery here, iliac, a little further down, and then the femoral. That's the vascular sounds. So, take a listen. All right, that's all of them. Okay, next, while you're lying down, I'm gonna check your feet. I'm gonna check your dorsalis pedis. I'm gonna check your posterior tibia. I'm gonna have you to pull up on my hands, pull down. Next, I want you to take the heel of one foot and go down your shin, just checking the cerebellar function. Oh, good, very good. I want you to have you to roll to the side. I'm gonna check for sacral edema. So, and you don't have any sacral edema here. Okay, then come back. Then I'm gonna let the bed down. And then, okay. Then I'm gonna have you just stand up for a minute. First thing I'm gonna have you to do, I'm gonna have you to close your eyes. Spread your hands out, and I want you to stand there for a minute. Okay.
I really wanted to do a positive Rollberg. I'm sorry, I didn't want to.
Okay, next I'm gonna have you to heel to toe. I want you to walk, take
Okay, really, I gotta do it that way. I know it's nasty, but.
4 steps toward me. You ain't been drinking.
Well, heel toe. I'm a fat girl. It's
Okay,
hard.
you can go back.
Yellow toe?
Yeah. Okay, that concludes our assessment. Did I leave out anything?
I was wondering about, what is it when you have the pen again and you bring it close?
Convergence.
That is convergence.
I don't know.
And accommodation is looking at the light and looking at the pen light.
Okay.
Okay. Indirect, when check, looking one pupil and not the other one.
Yeah.
Look, okay. Direct, indirect. Did I miss anything? I think I went back.
When it says vascular sounds, I'm just reading the paper because I haven't read the paper, I've watched the video. It says to over the spleen and the liver. So are you auscultating with your?
No, you can, only thing I want you to tell me if it's done. I'm just touching your belly.
It's just upon palpation.
Yes. Okay, just tell me where you would be palpating, where is it located?
Okay.
Or